Thank you for registering for our Perfect Care 3.4 webinar. My name is Kelly Ellis. I've been with NCG for 5 years in the training department. Before joining the NCG team, I did medical billing in a doctor's office that had Perfect Care for Windows. Today we will be reviewing the newest version of Perfect Care, 3.4. To log in, there is now a new icon on your desktop called Perfect Care EHR. Double-click on this icon. When you first log in for the first time, you will get the option to select which location you want to log into. You will select that location and click OK. Anytime you want to change that location, the next time you log in, hold the Control key down when you hit Login, and you will get that option again. As you see here on the home screen for Perfect Care EHR, there are no longer tabs across the top. If you'd like to view all tabs, you're able to click the default view. This will bring all tabs available to you as you're used to seeing in 3.3. At any time, you can X out of a tab by clicking on the tab and clicking the X box. You can also move these tabs around by left-clicking and dragging. If you do not want to use your mouse to move among the tabs, you can use your Control F6 on your keyboard, which will move the tabs to the right, and Control Shift F6 will move your tabs to the left. You are also able to be in multiple tabs at the same time. So if you are doing patient registration on a patient, and you would like to bring up a second patient in patient registration, you can click on your Navigate option, Perfect Care EHR, which will display your Perfect Care tabs, and then right-click on Patient Registration and open New tab. You're then able to open a second patient. To see which patient you have open among the different tabs, if you hover over the tab, it will give you the patient's name and account number. I would like to begin by going over the Navigate option. This Navigate option holds all your tabs plus all of your administration options. Prior in 3.3, administration was either under the administration menu in Perfect Care, or you would have to go to PC Admin outside of Perfect Care to add users and set up eligibility. All of these options are now here under the Navigate. Under Administration, you now have these options. The zip code maintenance has been moved here. Users and permissions, system tools, reference data, preferences, your electronic file services, which are your setup for insurances for eligibility. The audit system is to track what changes have been made in the system. You can do this by user, actions, and search. The next one is code tables. This is now where all your code tables are, including the new options of phone type and email type, which are new features in the patient registration. This is where you can add additional email types and phone types. You also will come here to add other things that you previously saw under code tables in 3.3, such as your appointment cancellation reasons, your appointment reschedule reasons. Also, you're able to add to your ethnicity, race, and preferred language, which are also new features in the patient registration. Anytime you would like to add something to these tables, you would right-click and click New. If you'd like to edit something that is already in a table, you would double-click on it. These are locked because these are defaulted by the government request. Under appointment cancel reason, you will see here, this one I am able to edit by double-clicking. The lock means this is something that cannot be changed. Your electronic file services have now been moved here from PC Admin. So this is where you would add additional insurances that you've added to your database to be able to check eligibility. By clicking on the insurance that you want to add to, then you would select the Add in the bottom right-hand corner, and then you would search for the new insurance that you have added to your database. Select it and OK like you did in PC Admin in 3.3. Your preferences are now here. These are your system preferences, or you can do your preferences by locations by selecting the location. Once you select the location, your groups are below: balance view, general behavior, patient registration, appointment. So these are all of the same that were previously in 3.3 under System Preferences Administration. At any time that you would like to change something, you would just click on it to the right. So if I wanted to set up a billing fee, I would just select billing fee and the grace period of when I would like this fee to be added. Of course, after entering any information in the system, you want to click the Save in the upper left-hand corner. Reference status will also be seen here under the Navigate Administration options. This is now where your appointment reasons, billing types, collection agencies, procedures, recall codes, all of these will be modified or added to. So again, you would double-click on anything that you would like to modify, or right-click to do a new. Your system tools will also be here. In 3.4 under System Tools, you're able to see what users are logged into PerfectCare, and if they have items locked up, such as accounts, you would be able to unlock them from here as an administrator. So here you can see that user demo is logged in using 9 licenses. Users and permissions will be where you now add new users and set up new roles and apply these roles, which are rights in 3.3, to your users. To set up a role, you would just right-click, New Role, give that role a name and description, click Next. You will then see where permissions are set up. Each section has individual sections below it And then as in 3.3, you would have seen add, change, inquire, and delete. You now see build, modify, view, and change. And each of these are similar under each option. The roles that you want set up for this specific nurse I have here, you would check the boxes that you would want them to have access to. So here, charge, I would like them to be able to view a charge. Clinical, I'd like them to be able to add to clinical, modify and view clinical. Documents, have access to documents. So you would just select those things that you want this role to have. Once you have selected the items, you would then click Next. And here, if your users are already added to the system, you can then add this role to those users by selecting your users on the left and clicking OK. The final screen is where you are able to confirm what you have done. And if there's a user that you do not want on this role, you can remove them, or you can add, again, additional users. Once this is complete, you will click Finish. If you have a user already in the system that you want to change their role, just double-click on that user, go to Role Membership, and here you can remove a role and add a role. In the first tab, you're able to expire the user from when they're able to access Perfect Care, expire their password, or force a password change at next login. And the final option under administration is zip code maintenance. This is where you can search zip codes, add additional zip codes, or make changes to zip codes. Also under the Navigate Perfect Care EHR, there'll be some additional besides tab features here. We have moved your tasking here, and also utilities, which is where you would close month end, create letters, set up special configurations. Tasking is also here now. So if you want to add a new task to a specific user, or view your tasks or the other user's task, it is now in this screen. It's a much larger screen, easier to manage. You can also see only the closed tasks, only opened, and all. And you can look at it in a specific time frame. The first screen I would like to go through is the patient registration screen. Here, when you open the patient registration screen, you will see that it has a new image. When I open a patient, all the features still remain the same. Your F2, your F3, your F4, quick keys all still work, or you can use the binoculars like in 3.3. You would select your patient. Here you will see to the right of her account number, we have a balance alert to make you aware if this patient has a balance and she has a credit. Also, if she has any notes attached to her account, you will have a Post-it note here. If you want to see the notes, you would just click on the Post-it note. All the demographic information still pulls over from the patient screen as before, and it's also viewable and changeable from this screen. You will notice here that we now have new options. If you'd like to add additional numbers, you are able to do that. and it will keep a nice log of each additional number for you. As I showed you in the administrative screen, you can add to these numbers and also add to these emails. Your second address option is now here as a tab rather than a button, and you're able to add second address, just like in 3.3. Under additional information, you will see new options such as ethnicity, race, preferred language. These are all new based on meaningful use. To the right, you will see that you're able to add a picture of the patient. You right-click. You can take picture if you have a camera attached. You can remove or import a picture. If you'd like to take a picture from another computer and put it on your system, when you do import picture, you can browse to where that picture is saved and pull it into the patient's account. You still have your more patient information where you are able to add maiden name, nickname, defer insurance claims, date of death, signature date. Under notes, you are able to set up multiple notes and see them in a listing option. You can add new notes by clicking the arrow star. You're able to move among notes. First note, arrow to the left with the line. To the very last note, arrow to the right with the line. Move one note at a time. Delete notes. If you open a note and you don't type in it, you have to delete it before you're able to move on. You still have the feature to make it a pop-up, so you can select all or select where you want this note to pop up and which screen. You're still able to expire the pop-up note here. Under contacts, you now have the availability to add multiple contacts, where in 3.3 you're only able to add one. You're now able to add multiple. So again, by clicking on the arrow star to add a new, I can add a contact. Then I'm able to add a second contact by doing star, arrow star again. And then we have multiple contacts. Again, you're able to see these in list format by clicking list. Under patient billing, this is where you're able to defer patient billing, set up a budget, payment plan for a patient. You also can assign a cycle date, change the cycle date, and also see the last time the patient received the bill. And as at 3.3, you still have the option to set up patient statement per patient. So instead of using the default patient statement, you can make changes specifically for a patient. In the case area, to add a new case, you will now drop down and do new case. The newest feature with case is that you're able to assign the responsible party based on case. So normal case may default to the patient or the patient's parent, but if you have a work comp case that an attorney should be receiving a statement, you can then set up the responsible party as a company for that work comp case. So anytime a bill goes out, it will go out to that company rather than to the patient. The rest of the case would be set up just like in 3.3, adding the provider they see in your practice, referring doctor, diagnosis and facility if you would like to add that information, location, which location they go to, and also your open date, onset type, and onset date. Under the insurance options, the new feature is that you're able to scan an insurance card. By clicking Scan here, Scan Insurance Card. If your scanner has a duplexing on it, it will scan the back and front of the card, and you'll be able to view it here in the patient screen. Adding an insurance is the same as in 3.3. And copay can be entered still. You can change and add insurances among the different tabs, so secondary insurance. But now when you want to move an insurance to primary, you will right-click on the tab and move insurance up, down, and you also will remove from right-clicking. So if I want to move Blue Cross Blue Shield to primary insurance, I would say move insurance up. Now when you're to save a patient's account, your save option is at the top of the screen. If you want to close the account, if no changes were made, you're able to close, open a new account, or open a brand new patient account. I will save her account by clicking the Save. All of your hotkeys still work, so to go back into her account, I can click F8. In insurance, you still have your approvals, but instead of them being a button, it is now a tab at the bottom. You're able to add multiple approvals. And then, again, with the list, you're able to see them in a list format. Now, if I was entering a new patient, we can click on the New page here. Auto Assign assigns an account just like it did in 3.3 automatically. You also now have the feature of creating a new responsible party for the patient or a responsible party for company when you're first opening up the account. And then you would fill in the information just as you normally would. The account number is assigned once you save the patient. Also in the patient registration, you are able now to run an audit report on a patient. So if information has been removed or changed, you now have the opportunity to run an audit report to see which staff changed the information, what the information was prior, and when it was done. You still have your option to check eligibility. In 3.3, you were able to delete an account, which actually just disabled the account. Now it's called disabled account or disabled patient here in the menu option. Another new feature is patient status. When a patient's account is first opened when making a new patient appointment, it's considered registration incomplete. Once this information has been entered in the patient's registration and it is considered complete, you would then go to patient status and make sure to remove the check so the system knows that this is complete. If this check is not removed, you will not be able to add charges and the account will not go over to the electronic health record. This is also where the account is frozen option is now. So as an administrator, you're able to now freeze the account or unfreeze the account through the patient status option. The next tab I'd like to discuss is the changes in the EHR in 3.4. You will click the tab, and like in 3.3, you will select your provider. But now those options you had across the top of the screen, the menu options, such as Open Patient Chart, they will now be down here on the left. When you select Patient Chart, this will bring up to be able to pull up a patient's chart. Now you have the patient's picture here to the left. But because her account is incomplete, I cannot open it, so I'm going to open a new one. And here you will see her picture, and to the right will be the normal tabs you see in Perfect Care 3.3. So along the left is to open the chart, New RX, New Orders, your reports, and your document management button. At any time, you can make the screen bigger by Xing out the pan. The next screen I would like to discuss the changes in is the charge screen. Now in the charge screen, you are able to edit multiple charges at one time. So I will select a patient. Then under Review Charge, I can select multiple charges by holding down my Control key and selecting the charge. And then by continuing to hold down the Control key, I can click Edit. I'm then able to make changes that will affect each of these charges either to the insurance company, the billing status if you want to reset to rebill, or changing the provider, billing provider, and all of these options here on the left. The new change in the payment screen is that when you add a credit to a patient's account, you are now able to add who that credit belongs to. So by clicking New and putting in the credit amount, I'm then able to select that the credit belongs to an insurance company, patient, system, or that I'm just adding it for a copay. When a credit has been added to a patient's account, you now have the option, when you're entering a charge, when you click the Quick Pay option, you can now apply the credit. And you do not have to go to the payment screen to apply. The change that has been made in the insurance billing screen is your billing configurations has been moved from administration preferences system level to insurance billing, maintain billing structures, billing configuration. So here is where you will find system level configuration for the entire system. And you will also still have here where you're able to set up insurance level configurations. So as system level configurations, as you used to see under administration system level, you will still see those options here. And insurance level configurations is right underneath the same area. The changes to the patient billing is if you currently do electronic patient statements with us, you are now able to preview the batch that you're going to send to us prior to sending it. So by clicking the practice, I can click Preview Now. I'm then able to deselect the patients that I do not want a statement going out to. After I deselect them, I can bill now, or I can save for later and come back. The final tab that I would like to discuss is the Appointment tab. As you can see, the Appointment tab has many changes. You still have your calendar to look at a specific appointment date by clicking on the calendar. And you still have where you can enter 2 weeks from today, and it will take you to that schedule. Under locations, you're able to change among the locations by clicking on the different options. And under schedules, you're able to remove the schedule you do not want to see here on your screen. In the toolbar at the top, the T will take you to today on the schedule. 1 takes you to just view 1 day's worth of appointments. 5 will take you to view 5 days, and then you can select among different doctors. 7-day work week is if you work Saturdays and Sundays. And 31-day month view will only show you percentage of that schedule booked. Another new feature in the appointment screen is that any time that you want to move a patient's appointment, if it's for the same day and you're in day view, you can left click on it and drag it and drop it. You will then get a confirmation, and you can change the duration of the appointment and the reason for rescheduling if you like, and then click OK. and it will move the patient's appointment. You can do it among the same doctor, or you can move it to another doctor's schedule. When an appointment is already scheduled, you still have your right-click option, but you're now able to add or collect a copay. So the copay amount will pull over from the patient registration screen, and you will put in the type and any additional information you would like. If the patient has a credit on the account that you want used, you can say use existing credit for copay. You still have your normal features here to check in the patient, mark them as a no-show. You also can confirm the appointment from here. You can still reschedule, cancel, reschedule later, print charge slip, check eligibility, and view chart. To schedule a new appointment, you would right-click on where you want to schedule the appointment, and you have the option of new appointment or a new patient appointment. If we're scheduling a new patient appointment, it will automatically default to 30 minutes because that is the time frame put in this template. But you can change it if you want it longer to 60 minutes. You will enter a reason code, just like in 3.3. Type in message, what the patient is coming in for, and you still have your options to add notes. When you click Next, this is where you will enter the patient's information. You have your different options. Click Next to enter additional information and to add their insurance. Now you have where you can either leave this as a temporary account as a new patient status, or create this patient account as a regular account, and it will assign the next available account number, or you can use an account number if you're entering those on your own. I will then click Next. Your final option is to add the patient to the wait list. So if the patient would like to come in sooner than the appointment you're giving them, you can add to wait list. You can select which provider they would like to see, a preferred date and time, and also if they want morning or afternoon, and finish. But now when you go to patient registration and you bring up this patient, you still have your options of activating the patient now or later. Also, the option for the system to assign an account number or you to assign one, and then continue. What I'd like you to see here is now we have this alert next to the account number stating the patient status is incomplete. So you will still want to make patient statuses active, but you also need to go up to patient registration, patient status, and make sure to uncheck this option once you've completed the patient registration information. Once everything is complete, you will click Save. Also up here in the new toolbar, you have check-in status. So when you're checking in a patient, you would be able to see which patients are checked in. So you will still right-click to check in. And then when you click on the check-in status, it defaults to today, and you're able to see the patient that has checked in. If they check out, the same. So it'll give you a nice list of who's been seen and who has not. You can switch this among providers. If you want to look at only checked in or checked out, and you can refresh. Also in the toolbar, you're able to see your wait list. If you put in a time frame and hit search, it will show you all the patients on your wait list. You also have your reschedule list here. So this would be where all your reschedule later patients would go for you to be aware of who needs to be rescheduled. If I click reschedule later for Sarah, and then go to my reschedule list, from here, you're able to double click on it to see the information on the appointment, or right click to reschedule. When you right click to reschedule, you will then select the date she would like to come in. Click on the time and then OK. And it will reschedule her appointment. Your Find Available appointment is now also in your toolbar. And just like in 3.3, you can set up the different search criteria. So if we wanted to find all available appointments between today and Tuesday for Dr. Taylor, in search, it will show what he has available. And when you double click on it, it will take you to that date. And you can then schedule the appointment as normal. Right-click, New Appointment, search for your patient, put in your reason code, message if you'd like. You're also able to see patient information and make corrections if you need to by clicking the Update button. And this will save to the database. See the patient's balance. See currently scheduled appointments, previous and future. A list of her canceled appointments. And add to wait list if she would like to come sooner. When you've completed scheduling the appointment, click Schedule and Close. The final option is appointment search. So say a patient calls in and they cannot remember when their appointment is. You're able to bring up that patient, and you will get a list of when she has appointments scheduled. If you want to see past appointments, you can check the box to include past appointments. To set up new schedules, you no longer have Schedule Research tab. You would now do from the appointment menu, you would set up templates and set up schedule maintenance. Also, your code maintenance is here to add any new visit types, appointment reasons, reserved reasons, and also location codes for checking in. So under Schedule Template, we'll make a new template. So for office, we're going to make the template for our office location, and then click Add, and then click Add again. Here you will see to set up your schedule rules. So because this office typically starts at 7, it's going to show 7 here. I will select what intervals I want my appointments to be in. And if I only want it to be 15 minutes from 7 o'clock till 10 o'clock, I would select that. You can also select the color that you want that section to be in. Show scheduled time as. This is where you would set up your visit type for that section. So if you want all of those patients to be your typical office visits with a office visit type, you would select that type here and click OK. Then to continue adding to this template, you would click Add again. And the start time is now going to default of where you left off the beginning of the schedule. You would then select when you want that to end, and I have it in 30-minute intervals. Select the color that I want them to be in, my visit type, and OK. And you will continue to create this template by doing that. So now I'm going to do lunch. So that's a reserved option. You can either select a standard reason or type in a custom reason. Then I'm going to finish my day in hour increments, blue, with a visit type of physical therapy. And then give this a name. So we've created a template. Now we want to add this template. So back up at appointments. You now have schedule maintenance here and schedule resources. Defined schedule resources will be for your providers. If you want to set up a non-provider resource, such as you see here, diabetic foot care, lab, nurse, you would click non-provider resource, right-click, or click on the white paper and add. Give it a name, and OK. Now, to add these schedules to the resources, whether it's provider or non-provider resources, we would build schedule. We would select the facility we're setting it up for, the resource we're setting it up for, select our template, next. Then we'd enter the date that we want this for. So I'll say starting the 13th. You can either put an end date in or how many weeks you would like it applied to. And then you can select the days of the week. So if I want this to Monday, Tuesday, and Thursday for the next 2 weeks, I'd click Next. It's going to give you one last time to view what you're adding to. In case you need to make changes, you can click back. If you're satisfied with the location, your resource, your rules, and the dates this will be added to, you would just click Finish. And here you will see that template that we set up. You can also change schedules by right-clicking at the top of the screen on the resource. If you click Clear Schedule, this will move all patients that's on that schedule to your reschedule list. Delete Schedule will completely delete this schedule. And Modify Schedule will let you make changes to this schedule without having to start over. Anytime you'd like to add locations to your schedule, that would be done under Navigate, Administration, Preferences, that would be Navigate, Reference Data, and that would be added under your practice. So if you click on your practice, double-click on it here under Locations. So you can add to it by clicking on the paper for New and adding in that information. That is the end to today's webinar. Of course, if you have any questions, you can contact us at our support line or email questions to questions@ncgmedical.com. If you're interested in scheduling the update, if you've not currently been updated, you can send your request via email, also to questions@ncgmedical.com. Your email should include the practice name, the contact name, and the best days and times to reach you. Also, if you have a special way you or preferred us contacting you, such as email, telephone, please give us that information also. Thank you for joining our webinar today.